Moving on to the next question, Karen, you're up on this one. What, if anything, can be done to help businesses and individuals with the ever skyrocketing costs of health care, insurance policies, and medical costs in general?
Well, what we have to do in the state of Minnesota, and hopefully it will be a Republican legislature, House and Senate, we need to file for a waiver from the Obamacare, because that's what's going to cause for the businesses their health care to skyrocket. We need to create a free market system, a consumer-based, consumer-driven healthcare choice, maybe opening it up to buy your health insurance like we buy our car insurance or our homeowner's insurance, open it up across lines, go to an online site, pick and choose a basket of insurance. A 62-year-old male doesn't need the same insurance as a 23-year-old female. So I think we need to open it up to consumer-driven solutions.
Thank you. Julie?
As I alluded to earlier, I have been a major advocate, a champion for finding more flexible, lower-cost health products for businesses in our state, and also to reduce the mandates required in healthcare products for small business and individuals in the private market in our state during the 4 years I served in the legislature. In addition to that, in my first year in 2007, I chief-authored the major Minnesota healthcare reform bill that was passed and signed into law by Governor Pawlenty. It set up the reform process that took place over the entire next year and culminated in 2008 with the biggest reform in Minnesota in the last 15 years. That reform is estimated to have knocked 12% off the cost of health care over the subsequent between then and up to 2015, which is approximately $6.9 billion. The combination of the two bills that I chief and co-authored knocked off the health care trend in the state, according to our estimates from the health care department, including for small businesses in our state. In addition to that, Minnesota, even prior to the Accountable Care Act passage of it, was talking about having its own Minnesota Healthcare Exchange. We will be moving to that Minnesota Design Healthcare Exchange in 2014. It's estimated that it will be a great opportunity for small businesses and individuals to purchase more competitively insurance on the market in Minnesota. The Chamber of Commerce supports the Minnesota Insurance Exchange. Estimates are that prices could come down 10 to 15% by more easily being allowed to compare products. Moreover, now that we'll have national standards on consumer protections, I am perfectly open to opening up Minnesota markets nationally to competition from other firms in other states.
Thank you. Our fourth question goes back to you, Julie, to start. Unfunded legislative mandates can wreak havoc on local government budgets. What, if anything, do you suggest can be done to address this issue?
This has been widely discussed in the last 6-7 years, particularly when we've had multi-billion-dollar budget deficits at the state level, and we have cut funding both to our schools in real terms, and we've seen the results of that through increased efforts to get levies, and we have also cut funding and resources to our counties, while at the same time expecting them to do more. As a result of that, the legislature for a number of years has had bills brought forth, including two that I brought forth over my legislative career, to reduce the mandates both in the education sector to allow more flexibility in various ways, to use their resource monopoly, and in the county sector. We absolutely, in tough budget times from the state level, need to free up those resources and allow them to be more flexible for all local levels of government so they can make best use of those funds. This is something that pretty much is bipartisanly agreed to. In the last 4 years, a number of initiatives have been passed in this area, both for education and for the counties, but we need to continue to do more.
Thank you. Karen?
I think one of the unfunded mandates that's been a big problem and an issue in our area is in the Lower St. Croix Valley, the Lower St. Croix Valley Fire Department. Anytime there is a fender bender on Highway 94 between Manning and the St. Croix River, emergency responders are required to go out to Highway 94 and bring their blocker fire engine trucks to block the area to make it safe for the police officer who has to go to the scene. So this is a mandate by the state, but every single year it costs the Lower St. Croix Valley Fire Department $25,000 to $35,000 a year. So the 5 communities in Lower St. Croix Valley, Lakeland, Lakeland Shores, Lake St. Croix Beach, St. Mary's Point, and Afton, have to somehow come up with this. It's not in their budget, but they still have to do it. And this is one of the, it trickles down to the taxpayer, and this issue has been coming up. It's been, even when former Representative Bunn was in office, this came across her desk more than 10 times, and it was completely ignored. It wasn't until Representative Lomer took office that she brought this to the state, and she is getting something done. So I do hope that when I'm at the Capitol, I can help the Lower St. Croix Valley get these funds.
Julie, 1 minute rebuttal.
Thank you very much for the opportunity, because the latter part of what was just said was completely false and erroneous. Senator Saltzman and I worked over a 3-year period in conjunction with those involved with the Lower St. Croix Valley Fire Department to try multiple paths to see if we could find the funds to do this. We actually had specific legislation written. We actually reached out statewide to try to build a coalition to support that legislation. Other fire departments were in the same session. This legislation came up at a time period, though, when we were facing the over $6 billion budget deficit. And when we worked with the legal staff on all the options for finding pools of money to pool over into this area, in each instance, the chair of the committees associated with those monies, whether it was were not willing to take this up and reallocate to those areas. So we continually reached a barrier at one after another. This is an important issue, and we should continue to work and find solutions with it, but this is one of the few things we were not able to accomplish during that time period because of the budget constraints.
Karen, rebuttal.
And this was brought to my attention by the Lower St. Croix Valley Fire Department, and they are here this evening. So this isn't coming from me just making this up. This is coming from them saying it was completely ignored by former Representative Bunn, and nothing did get done until Representative Lomer took it to the Capitol.
You have a chance for another rebuttal.
Well, if they're saying this to you, they're being partisan in some way, because the individuals in the room that I'm looking at that know we were involved, know we had legislation, know we had multiple meetings with them over many years, and I find it unfortunate that they would take a partisan stance and make that kind of claim at this time, because it was wrong.
Karen, you good?
Good.
All right. Next question goes to Karen. What specific reforms, if any, can and should be made to our K-12 public school system?
Oh, this is a good one. I met with Superintendent Corey Lund recently, and we had an hour conversation about how our education can be reformed. And I'm the daughter of 2 public school teachers, so education is very near and dear to me, and all 4 of our kids have gone through the Stillwater Public Schools. First, the funding formula. The funding formula is how much each student will get from the state, how much money they will give to each school district and each student. The funding formula is 73 pages long. Even Superintendent Lund needs to have a full-time person on staff just to try and understand the funding formula. The funding formula isn't equal either. Inner city kids get $2,000 more per student than we do get out here in the suburbs, yet that doesn't mean their test scores are higher. So we're throwing extra money at kids and their test scores aren't higher. So what Superintendent Lund and I talked about is how we could reform education. Look at how they do it over in Finland, where the teachers make a lot of money, their test scores are higher, and they have a whole different form of education. Also, we need to, everyone always says lower class sizes, but we keep throwing money at it, and the class sizes haven't gotten lower. So we need to really look at education and how it can be reformed.
Julie.
Well, you left a large umbrella of education reform generally in K-12, and of course there's the policy side and there's the financial side. First of all, we need significant reform on the financial side to provide for adequate funding, which is required by our state constitution, equitable funding, that word also appears in the wording in the state constitution, and stable funding over time. In addition, now in the current situation, we need to also pay back our school shift. We owe the schools over $2.4 billion that were shifted and have not yet been repaid. So we have a challenge on that side, and there are proposals out there by the Schools for Equity in Action, there are proposals out there, Parents United, there are proposals by the Minnesota Association of Metropolitan School Districts and the Rural School District Association to come together to develop, to revise the formula, revise the funding base for the formula to be both more stable and more equitable going forward, including for districts like Stillwater and Forest Lake in our area. And we need to continue with that process. On the policy side, what we all care about is effective teachers in the classroom. and principals that are accountable to the community and to their teachers. All the research shows having effective quality teachers is our #1 thing we can do for our children. Cara and I both have had children going through the Stillwater School System, at least in my experience. Our daughter received an excellent education, and in no small part to the really wonderful teachers that she had while there. We need to make sure we have policies at the local level, and if there's directives from the state, to ensure that teachers are properly trained when they enter teaching, that they are evaluated over time as they are involved in teaching, and that they remain effective in the classroom, and that our principals have the power and authority to both be flexible with the money to use resources in the most appropriate way, to work with teachers on the effectiveness of teacher and training in the classroom, and to serve our children in this state as best possible.
Thank you. Next question goes back to Julie, our 6th question of the evening. Should the top 2% of our state's wage earners be taxed more to help offset the state's budget?
Well, thank you for that question. There are a number of commissions that have met in the last 6 years to address what's viewed as a long-term structural deficit problem in Minnesota. What we've experienced with the deficits in the last couple rounds isn't just because of the Great Recession. That exacerbated the situation and brought it forth more starkly to us. We were experiencing deficits before that, and we will continue to experience them after that. Whoever enters the 2013 session coming up will face a real deficit of $4.5 billion. So we're back into that same situation that we started previously. In terms of why this is occurring, it's occurring primarily because of aging our population. As we age, more people over 65, over 85, our income and sales tax are flattening. At the same time, this population is demanding more and more government services from us. So there continues to be this structural gap that keeps popping up. So what did the Budget Trends Commission and also Governor Palente's 21st Tax Reform Commission recommend? Pretty much the same thing. It's also the same thing that the Minnesota Taxpayers Association is recommending. They're talking about needing to broaden the tax base in Minnesota to provide a more stable foundation for the future as the population ages. And they're also talking about bringing those health and human service costs under control. That has been my major focus as a legislator in the past. It will be in the future. So 3 areas: bring healthcare costs under control, redesign and innovate in government to bring more efficiency to our agencies and to our administration and design of our programs. We'll also have to do more cuts. That will be coming as well. And we need to look to those expert commissions by Governor Palente and by others and their advice in terms of what kind of modernization of our tax structure will serve us well into the future. To your question, I do not support a top-tier tax increase. I believe in these other approaches that outline these commissions. I do not believe that will be good for the business climate of Minnesota, nor to make us an island in the United States.
Okay, thank you. Karen, same question?
No. The problem isn't, we don't need to tax anybody anymore. The problem is a spending problem. We need to look at our budget and look at the spending. There's enough revenue coming in that we don't need to get any more coming in to tax anybody anymore. We need to look at the budget. We need to look where there can be some reform in the budget. Right now, the way the budget is, the way they operate at the Capitol, we could save money right there. Each one of the departments, the Department of Education, Department of Higher Education, Department of Agriculture, each one of those operates within a silo. They have their own IT department, their own technology department. If you streamlined all of that and had one IT department and one technology department for all of those individual departments, you'd save a ton of money right there. So it's not a matter of we need more revenue coming in. There's plenty of revenue coming in. We need to lower our spending.
Okay.